So this week and next week in class, we are going to be doing HESI reviews, and then we will also have those out of class reviews, just like we did for all the other exams that are going to happen next week. And we'll look at those timings after class. But for your HESI, the focus is going to be on application of information. Um, and those critical thinking skills. So, not a lot of just memorization of facts. It's more so, can you take care of these patients safely? So, we're testing in a written format instead of actually in person in a clinical format so that we keep our patients safe. So we are going to do some case studies, kind of looking at those critical thinking skills, just brushing up on those skills and answering those types of questions that you're going to see. So our first patient here is Ricky Sanchez. He is a term newborn born to young parents who are just 18 and 19. This is their first child, and dad works and mom stays at home, and they have no family support nearby. So, with those things in mind about our little family here, what are some of the risk factors that we see with them? You guys can type them in or shout them out, either one. So, risk factors for Ricky and his family. Yep. Lack of education, not knowing what those normal things are with them being first time parents. What other risk factors? We know parents themselves are young, they're only 18 and 19, so teenage parents trying to figure out their own lives, let alone taking care of a newborn. They also have no family support, so no good role models there to help them with that education. So Mrs. Sanchez opted for formula feeding, and at discharge was provided education related to the nutritional and fluid needs of a newborn. She was also given a 2 week supply of formula. She brings Ricky into the clinic when he's 3 weeks old because he's not acting normally. After obtaining a history, the nurse realizes that mom has been incorrectly mixing the formula. The assessment suggests that Ricky is experiencing water intoxication. So he's admitted to the pediatric unit for diuresis. So, what are we going to include in our plan of care for Ricky while he's admitted in the hospital? What interventions are we going to provide? Education for parents, yep, especially on proper mixing of formula, monitoring weight gain, signs of dehydration. What else can we do to help support this family? What's another reason that parents might mix formula incorrectly, other than a lack of education? Yep, being tired, being overwhelmed. If we aren't using enough of the powder, that's going to cause that water intoxication. We're getting too much water and not enough of the actual nutritional value there. So, what would be a reason? Yep, we're trying to save or stretch that formula. Very, very common trying to make that can go a little bit further because formula is extremely expensive. So, when we're trying to save resources, we might not mix formula correctly. So a referral to WIC or SNAP, any of those community resources that can help provide formula at a discount or even free for families would be really, really helpful there. So after that initial hospitalization, Ricky continues to do well. He receives his routine immunizations at his normal follow up appointments. And then when he turns 8 months old, mom decides to start working. So she places him in daycare. And within 4 weeks of starting daycare, he develops diarrhea that they can't seem to correct at home. So they bring him into the emergency room and he gets admitted a second time for rehydration. So, what are some goals that we would like to set for Ricky on this second admission? What are some nursing goals for this admission with Ricky? Once we determine what type of dehydration and how bad it is, what are we going to do about it? Yep, provide fluids. Yep. We want to reestablish that normal fluid and electrolyte balance that might be missing there. Um, lo and behold, we find out that the cause of Ricky's diarrhea is Giardia. So we are going to have to start him on antibiotics. Going to need some oral rehydration fluids to help correct that fluid and electrolyte imbalance. So we're going to start him on Flagyl and um, encourage oral intake there. And mom is obviously distraught, expressing concerns about causing the diarrhea, also missing work, dealing with Ricky crying when she leaves him. And he also ends up experiencing skin breakdown as a result of that long term diarrhea there. So, what do we include in our skincare to help correct and prevent that breakdown? Again, you can type them in or shout them out, either one.
Frequent diaper changes, keeping him dry.
Yep. Changing those diapers more often, keeping them nice and dry.
Maybe applying a barrier cream.
Mm-hmm. Barrier cream, protective ointment. Open to air. That's the one that we like to forget about. That oxygen on the skin will help heal that rash a lot faster. Anything else we can do? Make sure we're not using any chemicals against the skin. Making sure when we're cleaning that area, we're just using plain water instead of maybe a scented wipe or a wipe that would have chemicals in it as well. So Ricky's nurse is invited to talk to the daycare staff because they end up having several reports of Giardia in their daycare. Um, so providing that education there. After discharge, Ricky does well and continues to grow. He gets admitted one more time a year later with dehydration due to vomiting. Based on the orders by the healthcare provider, the nurse starts IV fluids and medication to help control the vomiting. And mom, again, feels really discouraged, feeling like she has poor parenting skills, which is very common when we've got multiple admissions in that first year. Thankfully, this is a short one, and Ricky recovers well and is discharged home. Mom keeps all of his well child appointments. He's not hospitalized anymore. Mom does say that during the whole process, she has learned a lot and feels more confident in her parenting skills. So, we never want parents to feel like they are failures, especially our young parents that haven't had a lot of education. So, how do we make sure that these young parents have the best chance for success after discharge?
By providing them with education.
Mm-hmm. Lots of education, making sure that they are doing that teach back or demonstrating what we're teaching to them so that they are 100% confident in their skills. What else? Follow up appointments, making sure they're staying on top of those so we can touch base, reinforce that education that we taught at discharge.
Maybe giving them resources for other parent support groups.
Yeah. Parent classes, parent support groups, other community programs like Help Me Grow. Those will provide more touch bases in between those normal pediatrician appointments. The older they get, the more spaced out they get. So that's really, really helpful for them. Lots of opportunities for success there. Okay, we are going to switch gears to our next patient, and we're going to look at sickle cell anemia here. So we have a younger school age client that is admitted to the pediatric unit with an exacerbation of sickle cell disease. The client is accompanied by their caregiver. The nurse meets with the child and her caregiver to discuss her health condition. The caregiver asks the nurse, I've heard of sickle cell disease and I know it can be very bad, but I don't know exactly what it is. So, what is our best response to that caregiver? You guys can vote on these. Yep, so we want to explain it in layman's terms, very simple terminology, so the caregiver can understand. So we know that sickle cell anemia is a disorder of our red blood cells that makes them abnormally shaped, that can block and damage our blood vessels, which leads to oxygen deprivation, pain, anemia, serious infections, and damage to our vital organs. The caregiver listens attentively to the nurse discussing the child's condition and what must be done to competently care for her. After reviewing the needed care, the nurse asks the caregiver if there are any other questions. The caregiver asks, "How did my child get this awful disease?" So, how do we respond to that? Who's going to break our tie? So we know that sickle cell disease is an inherited autosomal recessive disease. So we need to make sure family understands what that means. So the disease was passed on by both parents. For the child to acquire the disease, both parents must have the sickle cell disease trait. So each child of a couple with sickle cell disease trait has a 1 in 4 chance of developing that disease. The following Monday, the child goes with her caregiver to the local elementary school where she's enrolled in 3rd grade. The caregiver meets with the school nurse to discuss the child's needs while she attends school. The school nurse has cared for several children with sickle cell disease and is knowledgeable. She discusses the child's condition with her classroom teacher as well. So, which interventions should we implement for this child to prevent complications while she's in school? So, thinking about those triggers of sickle cell disease, what things are important to keep in mind for these patients while they're in school? You guys got it. We don't need to treat her any differently than other children, but we do need to keep in mind that she is going to have to hydrate more often than her classmates to prevent that sickle cell crisis. So, that increased fluid intake will lead to increased urination. So, she should be able to go to the bathroom whenever she asks. And the teacher should be understanding of the fact that she is going to go to the bathroom more often than her classmates. The school nurse reviews her immunization records from her previous school. The nurse notes the child had 4 scheduled doses of DTaP, 3 doses of Hib, 1 dose of MMR, and she received her Hep B series as an infant. So, looking at that, what recommendations are we going to make based on her previous immunizations? So, she had 4 DTaP, 3 Hib, 1 MMR, and she got her Hep B series. So, what recommendations do we have based on that information? How do we feel about her current immunization status? Thinking about those required immunizations for school. So she is in third grade. So according to the immunization schedule, she should have had a second dose of MMR when she was somewhere between 4 and 6. So she is not current with her immunizations. We only recommend a hepatitis A vaccine for high risk areas. Um, and influenza is recommended but not required. We always want to encourage it, especially with a chronic illness, but it is not required for her to be able to attend school. So she's been attending school for 2 weeks and all has been well. And now she reports to the school nurse that she's not feeling well. She has a temperature of 102. So the nurse calls her caregiver and advises them to go to the emergency room. The child reports pain in her knees, her elbows, and throughout her body. Once they get to the ER, the nurse confirms her vital signs. Temp is still 102, her pulse is 104, respirations are 24, her blood pressure is 90/68, and her pulse ox is 91%. So our physician is going to come in and see those vital signs as well, just the exact same thing. What do we anticipate the healthcare provider ordering for diagnostic testing? So based on those vital signs, what do you think the cause of her pain, not feeling well is? What tests do we need to determine that? So, the underlying cause for this sickle cell crisis is likely going to be some sort of an infection. We saw that she had an elevated temperature, plus, she's showing signs of a sickle cell crisis. So, we're going to go ahead and do a set of blood cultures so we can identify any bacteria that might be present and treat it with the correct antibiotics. Our peripheral blood smear just tells us that we have abnormal shaped cells. So that would give us our diagnosis of sickle cell. But we already know that about her. Same thing with the hemoglobin electrophoresis. That tells us exactly what type of sickle cell disease we have. It gives us the fingerprint of the blood cells. And then the sickle turbidity test is like a point of care screening test that we can use for anemia. So not going to be helpful in telling us what that underlying cause is. Our healthcare provider assesses and diagnoses our child with a vaso-occlusive sickle cell crisis secondary to pneumonia. Which order should we anticipate? How are we going to prevent complications for her or help restore her to normal? Yep, we are going to start her on IV fluids to reduce the thickness of that blood and prevent additional sickling from dehydration. There's no reason to start a Foley catheter on her yet. And we definitely don't need to put her in isolation. We can't catch sickle cell from anybody. And we know that cold packs would make that vaso-occlusion worse. We would use warm to help with that joint pain. After we start fluids, the child says that her pain is an 8 on the FACES pain scale. Which medication are we going to use? So remember, sickle cell pain is that moderate to severe pain. Most often, it's just severe pain. So we're going to have to go straight to opioids to provide relief. Ibuprofen is only going to decrease that inflammation in that particular area. Acetaminophen is not going to provide enough pain relief. Why do we avoid meperidine in patients with sickle cell? What can it cause? What complication happens when we give meperidine to patients with sickle cell? Not central nervous system depression. It's kind of the opposite reaction there. Meperidine causes seizures in our sickle cell patients. So that's why we avoid that. Um, so when we first get our patient and we are getting them all settled in with those vital signs, what is the first thing that we should do? So think back to those initial vital signs that we had. What is our first nursing intervention? Yep, the very first thing we're going to do is put oxygen on. Remember, her pulse ox was only 91, and low oxygen or hypoxia can also make that sickle crisis worse by preventing oxygen from reaching those clogged vessels. So once we get her hydrated and oxygenating, then we can start moving into those comfort mechanisms, starting to give her some pain control. The ED nurse continually assesses her for signs and symptoms of hypoxia. The child's caregiver presses the call button to tell the nurse there is blood in the commode after the child went to the bathroom to urinate. What action should we take? So, blood in the urine during a vaso-occlusive crisis. What do we do? Is this normal? Is it abnormal? Do we panic like the parents did? So, blood in our urine is actually an expected finding during a vaso-occlusive sickle cell crisis. So, we've got blood going where it doesn't belong because it's getting blocked from other places. So, we don't need to do anything about it. We just need to provide that education that this is a normal occurrence. We transfer our child from the ED to the pediatric intensive care department. And the nurse is working on the care plan and identifies in the nursing problem acute pain related to tissue ischemia as her priority. So, acute pain related to tissue ischemia. What interventions are we going to include to carry out that um, or nursing goal there? So, yep, we want to explain how to use that PCA pump. Remember, we're going to use opioids for our analgesic treatment for acute pain. So, when we give them on that PCA pump, the child has better control of their pain overall. So, explaining to both the child and the parent how to use that effectively. Again, we don't use cold. Tylenol is not going to cut it. And being in third grade, we would probably respond better to the faces pain scale over the numbers scale. The nurse assesses the child's vital signs, and now we have a temperature of 98.3. Our heart rate is 108. Our respirations are 22, and our blood pressure is still about 96/60. So, what action do we take with those vital signs? How do we feel about them? Normal, abnormal? Do we need to notify someone right away? Reassess? These are normal vital signs for an 8-year-old. So we can just document our findings. So anytime we have normal results or normal assessments, if we have to take an action, it's going to be that documentation piece. The child's in the ICU for 3 days and then gets transferred to the pediatric floor. Her caregiver has been at the hospital every day and is very concerned about the child's condition. The caregiver asks the nurse, "What can I do to make sure this never happens again?" So, what is our best response to that? So, our best response in the caregiver's question of how do I prevent this from happening again, there's unfortunately nothing that we can do to prevent a sickle cell crisis from happening. It's going to happen at some point in time. We don't have a medication that we can use to stop it. We definitely don't want to give aspirin because of the risk of Rye syndrome, so that would not be an appropriate intervention. Um, Keeping her away from infection or not participating in strenuous activity might reduce the number of crises, but will never be able to completely prevent them. So, providing that reassurance that it's nothing that the parent did that caused the sickle cell crisis. We just have to try and do our best to understand the um, early signs so we can get them treatment so that we can minimize how severe the crisis is and attempt to reduce the frequency. The caregiver goes downstairs to get something to eat from the hospital cafeteria. The unlicensed assistive personnel informs the nurse that the child urinated in the bed and is crying and wants her caregiver. What do we do first? So, the very first thing that we do for this patient. So again, we've got increased fluid intake, so accidents may happen. First and foremost, we attend to our patient's physical needs. So we want to help her change her clothes, get her clean and dry. Then we can worry about changing her bed linens and getting her caregiver. We definitely want to allow that caregiver an opportunity to get food for themselves and take care of themselves. But our patient is our number one priority, so attending to their physical needs first. So once our child is cleaned up and repositioned, she realizes that she is also hungry and would like to have a snack. So, what food should we offer to a child in a sickle cell crisis? What's going to be the best choice for them? Yep, so all of these are relatively healthy choices, but the popsicles are going to help improve her hydration status. Uh, Our child starts to feel better and is requiring less pain medication. She's sleeping as the nurse makes evening rounds. Her caregiver shares with the nurse, I have no idea what my daughter should be allowed to do so that she can have some fun. So, what suggestion would we make? What's the best response by the nurse? So this one is a little bit tricky. Our first response there is technically therapeutic communication, but it doesn't actually address the question. It's not getting to um, what the parent asked. So, encouraging formal organizations that help foster the patient's self esteem, her confidence, earning ranks and merit badges, interacting with her peers, learning new skills, those are going to help develop her self esteem, work on those developmental milestones for that particular age group. Remember, she's in third grade. So she's going to be in that sense of industry. Um, so that's going to help those school age groups like Girl Scouts, Girls Clubs. Those are going to be helpful for her. Which statement by the child indicates she is meeting Erickson's stage of development for her age? So we just said that she's developing her sense of industry. So what example do we see? Nice job. With that sense of industry, they like to do and accomplish things. So finishing a puzzle is accomplishing something together. Um, our peers are going to be important to school age kids, uh, but they are going to want to be involved. It's not necessarily talking about that identity or industry setting. And then looking at that vocation would be more appropriate for an adolescent that's trying to develop their identity. Okay, we are going to go ahead and stop there tonight so we can take a peek at what is coming down the pike for us as we wrap up our term together. So, if you did not turn in last week's NCLEX questions, you can still turn those in by Sunday for partial credits. So make sure you get those in. This week, we just had our discussion 7 post. As we're getting ready for HESI, we're giving you lots of practice questions to help assess your readiness. So week 10 NCLEX questions, and then you have 2 separate HESI assignments that will be due. So your practice exam and your assignment exam. Remember, you have to access them through the link in the module. And your grade directly transfers over to the grade book. So there's nothing for you to actually submit for those 2 assignments. So make sure that you're using those links so that your grade transfers. Also know that your first attempt is the grade that is recorded. So you can complete them as many times as you want, but your first attempt is what gets recorded and transferred into the grade book. Week 10 is also going to be those out of class HESI reviews. So from each of the instructors. So Dr. Becker is doing hers on March 10th, which is Monday at noon. I will be doing mine on Tuesday, the 11th at 4 p.m. Eastern Time. You guys get a bonus review for the HESI with Professor Bogart. So she will be doing hers on Saturday, the 15th at 2 p.m. Eastern Time. She does a giant joint review with all the RN and PN students that are taking pediatrics. And she focuses a lot on critical thinking and how to answer these HESI type questions. So how do I figure out what an application question is asking me? How do I make my best guess on the answer? So if you can only attend one live review, that is the one that I strongly encourage you to attend. She is phenomenal. Pick her brain for how to answer questions and understanding that content that's going to be on the HESI. Professor Luminoso will be doing the last HESI review on the 16th, which is Sunday at 4 p.m. Eastern Time. So that'll be your last chance to get those final questions answered before you guys start testing. You will all be testing on campus at different times during week 11. So we will not actually meet together week 11. Your HESI counts for your attendance in class that week. So as soon as your HESI score is posted, then I will be able to grant your attendance for week 11. If you guys have questions, reach out to the campus as far as scheduling, room locations, your date and time. I can kind of see a general idea of when you're supposed to test, but the campus is the one that controls all of that scheduling. So like I said, we will not meet together week 11. Your HESI counts for your class that week. Once you have finished your HESI, please make sure that you do your remediation. So I cannot turn on final grades for anyone until the entire class has completed their remediation. So even if things don't go your way and you have an outcome that is different than what you expected or anticipated, please still do your HESI remediation so that your classmates can get their grades. Because like I said, I can't turn it on for anybody until everybody has completed their remediation. If you choose not to do your remediation, you'll end up with a 0 for your HESI and you will fail the class, guaranteed. So please, please, please do your remediation. Also, if you end up having to submit an appeal and you didn't do your remediation, that's going to look really bad to the appeals committee, and they are likely going to deny your appeal. For week 12, we still will meet together just to complete our course evaluations, make sure that I didn't make any mistakes in the grade book. I don't have any typos or anything because I am human and I make mistakes sometimes. So please make sure that you come back to me week 12, no matter what, just to protect your attendance. If you miss week 12 with me, something funky happens with your schedule week 1 and you miss class, you can be dropped for 14 days of non-attendance. So protect yourselves. Just show up for that really quick touch base in week 12. It's short and sweet, and I let you come to any of my classes. So you don't have to wait until Friday night to meet with me. We just have to meet at some point in time during that week. What questions do you guys have?